Welcome to the Physician Pharmacist podcast, a show designed to shed some light on a very unusual pathway into medicine. I'm your host, Nathan Gartland. I'm a licensed pharmacist and second-year medical student. I'm also the author of PharmD to MD and the owner of the Physician Pharmacist Company. Most pharmacy students and professional graduates are aware of the possibility of going to medical school, but very few actually take the leap. We are here to unpack some of these details and open your eyes to the possibility of a career in both pharmacy and medicine. In today's show, we will cover topics related to applying to medical school, international medicine, a recap of our entire year of clinical rotations, including surgical rotations, introduce USMLE STEP 2, our national licensure exam, and finish up with the medical residency application process. I'm very excited for our third episode of the Physician Pharmacist podcast mini-series, where we will be interviewing Dr. Tess Calcagno. Dr. Calcagno received her pharmacy doctorate from Duquesne University in 2019. Upon graduation, she immediately matriculated into the University of Miami School of Medicine in Florida. She is currently finishing up with her third year of medical school and has a year of clinical rotations under her belt and is quickly approaching the medical residency applications. Welcome, Dr. Tess Calcagno.
Hey, thank you so much for having me on the podcast. It's a pleasure to be here.
Yeah, I'm super excited to have you on the show, and I think we're going to have a great episode today, and we're just going to unpack a lot of details and share a lot with the pharmacy community.
Yeah, I'd love to. Let's do it.
Alrighty, so we'll start out with some general questions. Now that we've heard, your introduction and a little bit about you, let's hear a little bit more about that. What got you started with pharmacy in the first place?
Yeah, of course. So I'm originally from central Pennsylvania. I grew up near Hershey, Pennsylvania specifically. And when I was in high school, I was looking at sort of anything in the healthcare field. And I was very drawn towards pharmacy because I was really interested in chemistry in high school, and they had, these 6-year PharmD programs. So it seemed like something that was, it would fit like a nice timeline, and I'd have a good career, and I'd be able to, enjoy life outside of my career as well. So I went ahead and took the leap and applied to pharmacy school at Duquesne University with Nate in Pittsburgh.
Awesome. Yeah, I followed a very similar kind of introduction into pharmacy as well. I heard about the 2+4 program, and I like how you mentioned like the balance outside of, outside of work and outside of your studies. You could get the degree taken care of in a couple of years, and then you'd have, a pretty good salary and a very good work-life balance. So that was one of the major features that drew me into the practice, as well as the classic cliche of, oh, I was good at math and science. So I love that.
Yeah. It's a cliche answer, but it's honestly, what do we have to go off of in high school, right? So
exactly. So kind of building on that, was going to medical school, always your plan? It seems like pharmacy was the original, plan, I guess. How did you transition into the idea of wanting to go to medical school?
Yeah, so it definitely was not my original plan. When I first went to pharmacy school, I remember going home like the summer of freshman year of college, and I was working at this little retail pharmacy, and I was like, I was pretty sure that was what I was going to do. It wasn't until my first professional year in the pharmacy program, so like year one of pharmacy school itself, not undergrad, where I started to see more of the, again, cliche, but the science courses, and specifically the courses related to medicine. And that idea kind of came into my head at that point. And then throughout pharmacy school, this idea was kind of fed by different experiences that I had, like in the clinics, and just in class itself, just being fascinated with the information.
Yeah. And I think I'd also like to add to that, to humbly recognize, the mentors that I'd like to say, like, I'd recognize that you served as my first, introduction to medical school. While, I had been considering the idea similar to yourself, it was only a fantasy in my head. I remember telling you telling me about your ambitions for medical school while you were on pharmacy-based, medical mission trip in Haiti. this introduction, along with the work we did on the ground, was like profoundly influential in my own decision to seek out care in medicine. So I think, having a mentor like yourself was super influential. And I know you had a mentor, along the way that also helped influence your decision.
I think, and I thank you for that. I feel very honored to be, have served in any way for you. And I know that having somebody where you can kind of see like, oh, hey, like it's possible. This isn't like some crazy thing that, you're just kind of coming up with in your head for your own, crazy reasons. But no, this is something that can be done. And I think knowing that like most applicants that go into medical school these days, they've done something after undergrad, whether that's like another graduate degree, or maybe they've taken a year off for research, maybe they've traveled, maybe they've had a whole different career, so it kind of normalizes like this route to medicine.
Certainly. And what I've seen in my experience is that the PharmD is no longer a destination degree. It seems to be a stepping stone for a lot of people. It doesn't necessarily have to be, but it's being utilized because it's a very recognizable degree. It holds a lot of merit and status, I think. So it's very useful to transition into other fields and use that background. So yeah, I love that.
100% agree. Yeah. Even, outside of medicine, it's a stepping stone for a lot, law school as well, PhD, or maybe like, master's in public health, many things.
Exactly. And kind of building off of that, I mentioned, our medical mission trip to Haiti. I was curious to know and ask you, do you still have an interest in global medicine? And would you recommend pharmacy students participate in a similar experience if given the opportunity? Because I definitely would, because of how, influential it was in my decision-making, just in my clinical exposure and perspective of healthcare.
Yeah, when I was in pharmacy school and when we went on the trip to Haiti together, it was really cool because that was like my first time seeing the patient in the entirety of the clinic visit, kind of shadowing and getting that exposure. And in that setting, I feel like it's very good exposure because you're able to see a wide variety of patients quickly. You're working with the physician closely. And as far as global medicine, I think that I am very interested in it still. It's part of the reason I chose University of Miami. We have a population of people from around the world actually living here in our hospital. A lot of people are from South America, Central America. We have people from Haiti, so in the Caribbean as well. And then, it's very national here in our hospital. So that's been like kind of my way to pursue global medicine locally, which has been really cool.
Fantastic. Well, we'll transition into our next section of the interview, and that's talking about the medical school application. So I know it's been a little while since you applied at this point. The processes are already changed dramatically just within the last 4 years. Do you mind just sharing a little bit of what that process was like for you, especially while doing it in pharmacy school?
Yeah, so the process was, I remember it being very early. It's a year and some change before you're actually matriculating into medical school. And I remember that I had to be very organized. AMCAS opens at a certain time and you want to be able to submit it the very first day since applications are rolling. At least they were back when I was applying. And as far as balancing that with pharmacy school, I was on, my 4th year of pharmacy school. And like, as you guys know, if you're in pharmacy school now, or if you're a practicing pharmacist, the 4th year is primarily like clinical rotations. So you can be flexible in terms of interviewing and taking electives at different times and kind of like molding your schedule to how you want to spend your time.
Yeah, that was great. I think 100%. It was much easier once the rotations had started because I could make my own schedule. I wasn't really dependent on exams. And I think that was a major feature that I appreciated like you mentioned, off blocks as well for interview season, so you could fine tune your application or fine tune your experiences to
Yeah.
match your interview cycle leading up to appy rotations. I would argue that it's pretty stressful time period when you have to plan for the
Oh yeah.
MCAT and everything like
Yeah.
that.
I would agree. Like once you have all of, I guess once you have all your ducks in a row per se, like you have your letters of recommendation, you have, your MCAT scores done, you've written your personal statement maybe, and you're gearing up to apply, the actual year of application was not stressful. But I think the preparation component, it can be stressful, but just taking it one step at a time and realizing the things that you need to kind of have in place for that year to be a smooth transition into medical school.
One of the nice features too is that a lot of pharmacy students who are interested in pharmacy residencies have already been working on building their application up. So transitioning over into medicine wasn't anything, too far-fetched. We had already put the work in to have good grades. We had already been involved in research experiences. So we didn't really have too much more legwork. It was more so organizing everything and making sure we checked all the boxes.
Yeah, I think the major, key to success during the final year before you apply is just organization. At that point you've put in all of the grunt work throughout your time in pharmacy school and undergrad. Now it's just time to kind of make sure everything is like 100% where, it needs to be.
And if my memory serves me, you had a very successful application cycle with many high-tier interviews. When it came down to it, you kind of prefaced this already, but I know you had to choose between Georgetown and Miami, and Georgetown is a very, well-recognized and prestigious program. How did you come to that decision? Was it as obvious as the interest in international medicine, like you mentioned, or were there other features that you had to consider? Because I know you were really struggling between the two at the time period.
Yes, yeah, that's a great question. It's one of those decisions in life where it's kind of like, a hinge point, and you often look back on it. But I feel that I made the right decision. And at the time, the reason I made the choice was I grew up in central Pennsylvania. I went to school in Pittsburgh. And I hadn't really lived outside of Pennsylvania. And I kind of wanted to force myself to get out of my comfort zone a little bit. And when I went to interview at the University of Miami, and then when I went back for second look, it felt like a whole new world down here. You have a different language, 50% of the time, different culture, the weather's different. It's a different vibe. So yeah, a lot of it was factors outside of the program itself, because I think at the end of the day, like they were pretty comparable in terms of academics.
Fantastic. Alrighty, so kind of moving into the specifics of your medical experience, let's discuss your life in medical school. So as you approach the last year of medical school, could you tell us a little bit about your journey starting at first year? What was it like? How did you adjust?
Yeah, so my journey starting first year was nice. I had a couple months living in Miami before classes began. During those months, I was actually studying to take the NAPLEX. So then I took that exam, and then medical school began in August, and it was an amazing experience. I met, hundreds of people within the first week. I was introduced into medicine. I got a white coat. And then the kind of the work began. We did basic sciences during our first year. And we began with anatomy, and I just remember working very, very hard, and trying to balance all the classes. It felt very, very similar to pharmacy school. And I know we'll get into that, but yeah.
Yeah, I love that. And anatomy is such a beast of a class that it's something, especially as pharmacy students, that a lot of us have never seen before. We were never trained in the intricacy of anatomy. So I think it can be a frustrating class to transition into, because it's something that we don't have a little bit of a baseline knowledge on. And then we're sitting next to one of our classmates who might have had a PhD in anatomy or did, extensive work in other classes. So staying in your own lane and recognizing that, you have to just work as hard as you can, I think is also an important facet to carry forward.
For sure. I think medicine and being in medical school has been a very humbling experience, to say the least. And I think that, if you do choose to go this route, know that like there's still a lot to learn. It's a whole different field. It's a whole different profession. But yeah, it's good.
So what's something you like about medical school that's, I guess, a little different from pharmacy school? And then to kind of throw this in there, what do you like? What do you remember you liked more in pharmacy school compared to medical school? Is there anything in particular?
Yeah, for sure. So the thing that I'll say about medical school that I really, really like, well, I guess there's a couple things, but the first one I'll relate to academics, in the sense that in medical school, we spend the large majority of our time in clinic. So it's a lot of hands-on experience. And the lectures that we do have first year and a little bit of second year, they were all recorded. So it felt like a very adaptable curriculum where I could like be home in my pajamas and listen to a lecture on 2.5 speed and then, go do some practice questions. And I kind of felt like I was learning more rapidly and more efficiently. And then the second thing I'll say that I like more about medical school is it felt to me that the support system between myself and my colleagues was a little bit stronger. Maybe it's trauma bonding, I don't know, but just I felt the support was a little bit more there, as opposed to pharmacy school, where I felt that everybody maybe would go home at the end of the day, like go back to their own lives. It was less like immersive of an experience. And then for pharmacy school, what I liked about that was I would say that the information was a little bit, the resources to which like you acquire the information were a little bit more organized. For example, in medical school, we use a bunch of different question banks to try to do well on our board exams. For pharmacy school, it was just like, the lectures, you like really know those lectures in and out, you'll do well on the exam.
Yeah, absolutely. And having just that one comprehensive like NAPLEX style book, that's all you needed. You didn't need any other outside resources versus I'm gearing up for my step 1 exam right now. And I have like 15 different tabs open for different like programs and practice questions of the day. And it's definitely a little less organized. So I 100% appreciate that point right there. But all right. So you mentioned a little bit of clinical rotations just a moment ago. And so for our listeners, clinical rotations are a major component of the medical school education process, in the sense that we spend 50% of our time of our years in medical school just in clinic. So our 3rd and 4th year are spent basically on the wards or in clinic or in a doctor's office. So Tess, can you walk us through some rotation basics, some information on shelf exams, how the scoring and honor system works, and just kind of your day-to-day experience? I know that's a lot right there.
Yeah, of course. I can do my best. So I've done all of the basic core clerkships. Well, I'm finishing up my last one here in family medicine. So what it kind of is, it's similar to a day at work. You go in at a certain time and you leave at a certain time, and you're expected to do whatever the team really needs you to do. It was the first opportunity that I truly felt and said to myself, like, oh, wow, like you are gonna be a doctor, like you're doing it, so I felt like they kind of took the training wheels off pretty quickly and kind of threw you in and expected you to know how to take care of patients, how to pre-round on patients in the morning if you're on a hospital rotation, kind of follow those patients throughout the day. And then you go home and you study for your shelf exams, primarily through questions is what most of us do, UWorld questions. And then you go in and do it the next day. So it's very much like a clinic, and then you study for your shelves, and you get graded through clinical evaluations as well as your shelf exam score.
Awesome. Yeah. To clarify some of those points, like you mentioned, with shelf exams for our listeners, those are essentially miniature board style checkups to make sure you're learning what you should be learning, and to standardize the education process for across all medical schools. Correct me if I'm wrong on that test,
No,
but
yeah, it sounds great.
and then also with honors and scoring, it's basically an evaluation of how well you are doing on the wards. Are you professional? Are you handling? Are you basically operating in the sense that you are going to be a doctor someday? Even if you're not perfect with how you handle things, or if your clinical knowledge isn't perfect, showing that interest to learn, I've seen or heard that is so important. Just taking an interest in a particular field or volunteering to take on a challenging patient can go a long way. Similar to how you should treat it just with your API rotations. And that kind of transitions into my next question of, how different are medical rotations from your pharmacy API rotations?
Yeah, so that's a great point. I don't want to give a cop-out answer, but I truly feel that it depends on the rotation. I've had rotations where I've been responsible for 4 or 5 patients on the service, and I would see them in the morning. I'd present them on rounds. They'd be my patient, and I'd write their note. I'd do all the follow-up, and I'd feel like, I'm really at the level of, a resident. But there have been some rotations where you're kind of expected to take more of a role of like shadowing the residents and the other physicians. So it really can depend and vary based on, the team you're with, the specialty you're in, etc. For pharmacy rotations, I felt that they were similar. They were all similar to one another, right? Like you kind of had your role as a student, and they would involve you to kind of a standard degree across all rotations.
Yeah, absolutely. That's definitely a good way to compare the two. And it's a little different in the sense that, with pharmacy rotations, you do an acute care rotation. That can be in anything per se, or you do a community-based rotation. Right. Versus with, medical rotations, some of them are related to you're in the OR for doing this particular surgery or assisting on that surgery, or you're working with anesthesia, or you're, an OB-GYN. So there's a lot of different, I guess, more subspecialties that you can get involved in. Versus, you're only limited to 1 or 2 acute care API rotations, and you only get to see a couple tiny things, So I think with the medical rotation system, the fact that you also have 2 years to do it also adds to the breadth of exposure that you get.
Yeah, I agree 100%.
Alrighty. So my next question is, and I'm sure that I know your answer already, but do you believe your pharmacy training has helped you in your medical school and on the wards?
Yes. Yeah, for sure. Hands down. So it didn't help as much as I would have liked it to, like the first 2 years, honestly, because it's a lot of like knowing the disease pathway and like anatomy, as we were talking about earlier, and like memorizing like genetic conditions and like biochemistry behind diseases. That was really important for step 1. Clinical years, for sure. Like, every patient you see is going to be on a medication. Well, usually every patient, so that helps a lot to understand and know, like just in clinic today, like this guy was hypertensive. He had a coronary artery bypass graft in the past, and like he was on metoprolol for his blood pressure, and I'm just like, that's not, he needs to be on better drugs. So that's just an example. But
yeah, I love that, because especially I'm glad to hear that too, because in my first 2 years, I would agree with you that there isn't as much pharmacy focus, especially in the first 2 years of the medical education process. When we cover beta blockers, we cover the first agent, and that's about it. There's no other beta blockers exist, in the curriculum.
Yeah.
And having that pharmacy background makes me sit there and I'm just like, getting heated thinking about, oh my gosh, how are we blowing through this super important topic? Why aren't we talking about the heart failure guidelines? Why aren't we talking about all these other clinical, facets, PK, pharmacokinetics, all this important material that has so heavily focused in pharmacy. And it is somewhat overlooked, I think, in the first 2 years of the medical education system. Obviously, the focus has shifted. So, there's not as much time to dedicate to that particular information. But that is reassuring to hear that I will get to use a little bit more of that knowledge base on rotations.
Oh yeah, you will. There's never like a formal, education. It's kind of what we get in the first 2 years, but you're going to be well above your peers and your colleagues with your pharmacy background.
Alrighty. So lastly, I'd like to introduce the USMLE STEP 2 exam. For our listeners, this is the second national board examination that is used to quantify your merits in medical school. Many residency programs look at a student's STEP 2 score when comparing applications for positions. Now that STEP 1, the exam that I mentioned, as well as in episode 2 with Dr. Bryce Grohall, mentioned as well, is now transitioning to pass-fail, I believe there will be an even greater focus on the performance of this particular exam, not necessarily for Tess here, but for coming physicians in the future. So I'm wondering, do you agree with this assessment, and how are you personally planning for these boards? I'm not sure, you might have even taken them already, but I'm curious to know.
Yeah, so I took step 1 scored. So that was a thing, and that is done. And, I think that the shift to making step 1, pass fail, makes step 2 the only objective indicator, so I think that step 2 will be extremely important for medical students and future residents in the future years, and even during my year, because I know that it's like 50-50 on those people that took step 1 pass fail versus scored. And step 2 it's very similar to step 1, but it's a little bit more practical knowledge, I would say. It's more of like management questions about like, what would you do next? And this is very near and dear to my heart right now, because I'm studying for step 2 and I plan to take it in June.
Yeah, that's actually when I'm taking my step 1 as well. Nice. May 27th. So,
all right.
Unless I have to push it back, but hopefully that's not the case. But no, that's a good synopsis on step 2. And I'd agree with you that while I'm happy at the moment that I don't have to put as much effort into step 1 because of the pass fail transition, it does worry me a little bit in the sense that all this pressure has now been shifted to the back end of our education process. And a lot of residency programs aren't really sure what to do with the lack of this, what was once a purely objective and deciding a critical component to how to classify, residents for positions, or I guess applicants for residency positions. So it's going to be a very interesting time for medicine.
Yeah, I think it's very interesting. And, we'd like to say, oh, well, the shift is going to be focused to research experiences and letters of recommendation, et cetera. But those things are, while important, are not, objective. If you're a program director, like I imagine that it would be nice to just look at the paper and say, okay, this number sounds good, this number not so good, and just kind of flip through things. But I think it's going to become a lot more complex. And I think that, residency program directors have a big task ahead of them.
Yeah, I'd agree entirely. And one final point to that is, is this going to turn into which, medical school is more prestigious? Is that going to be a factor? Because we no longer have one of our, objective tests. How can maybe a potentially lower tier medical school applicant compete versus, a Harvard applicant if we've taken away that measure? So there's a lot of pros and cons to the decision. And it's something that I think, like you said, is going to be unfolding as the years progress. So I'm excited to see where the guinea pigs for this. I guess technically, some of your classmates might also be if they didn't take a scored step one, but it is an interesting phenomenon nonetheless.
Yeah. And I've also, just one more thing, I've noticed that a lot of people in my class have and are going for more competitive specialties, with that past step one score, hoping to, achieve a good a step two score, which, is interesting because it might have not been the case if they were to take step one scored.
100%. That's definitely an interesting point as well. Alrighty, so transitioning then, so now for the big topic, I guess, that every medical student dreads is residency applications. In contrast to pharmacy school, where a growing minority apply for a residency position, every medical student must obtain a residency to practice and use their degree. To further complicate the matter, there's an overabundance of medical students compared to ACGME accredited residency positions, leading to a rise in unmatched graduates. And essentially not matching is, for our listeners, is pretty much the worst possible outcome, because you're sitting there, you have to either take a research year or some other kind of filler or pick up a job that's not in medicine. So the goal is to 100% match the first time around, or you're going to be in for a rough ride. And that's not to say that you won't match in the future, especially for applicants who are very competitive, who are going for very competitive specialties. They have a better chance than, let's say, a less competitive field. But I'm curious to know, what are you planning on applying for, and what have you done to make yourself a competitive applicant?
Yeah, so that's a great point. Unlike pharmacy school, we have to do residencies most of the time. And for me, I'm going to apply to internal medicine with the ultimate goal of applying to cardiology for fellowship and practice as a cardiologist. So for me, internal medicine was a great decision, and I really enjoyed my rotation on it. And what have I done to make myself stick out? Honestly, like do what you enjoy in medical school, make a podcast, like Nathan's doing, or do what interests you, and kind of you'll start sticking out. For me, I like to tutor a lot. I've had a lot of research experience in pulmonology, and just study hard, do well in your clerkships, get good step two scores, hopefully, and good letters of recommendation. But just be very happy about medicine, and good things will kind of come to you.
Yeah, and I think what I've seen from and heard from, reports from other classmates ahead of us is that a lot of, once you kind of get that interview scheduled and everything, it's more so just being a good person, being charismatic, answering questions in a pragmatic way, and just kind of being a resident that a lot of people want to work with in the future. I think that's like, everyone in medical school is all applying for the same positions. And if you haven't noticed, everyone in medical school is already, very qualified. So it gets even harder to kind of stratify or differentiate between a lot of these applicants. So sometimes it just comes down to having that personality, that one or two features that makes you stand out from the crowd. And adding to that, I want to ask you, do you think your pharmacy background will be of interest to program directors and make you, more competitive per se? Does it add that wow factor, I suppose?
I would say so, especially in the setting of, like, as we discussed earlier, the limiting objective factors that these programs can use. If they're sifting through thousands of applications or hundreds or whatever, and they see, oh, okay, PharmD, well, that's a little interesting. And then, I think if somebody knows what a PharmD is and knows like everything we had to study and knows our skill set very well, maybe they've worked with a pharmacist before, they will be very impressed.
That's definitely reassuring to hear as well. But all right, so transitioning to we're kind of working our way through your process, because you have step two on the way. Residency planning has to go into your next couple months after you take step two. I'm curious to know, let's talk a little bit about sub internships. How important are these? And can you just, tell us a little bit more of what they are exactly and why most of them are done in your fourth year of medical school?
Yes. So a sub internship, known as a sub I, is basically an acting internship for a medical student. So the best way that it's been explained to me is that it's like a 4-week long interview where you essentially act as an intern. People applying to different specialties do their sub internship within the specialty that they're interested in applying. And it's done in the fourth year of medical school because at this time you've had, a baseline and a background of all of the other specialties, and, you're gearing up to apply to residency. So you kind of want to have like letters of recommendation that represent the closest thing to what these programs will be receiving, in a way. So I'm doing my sub-I in internal medicine in July for 4 weeks, and presumably I'll be working like 12 to 14 hours a day and getting a letter of recommendation and then submitting it for residency applications.
And I think that translates a little bit too to how API rotations go when it comes to students interested in pharmacy residencies. Is a lot of the recommendation is to do competitive, difficult rotations that would prepare you for potential residency interviews or residency spots at different programs. So I think that's a good way to parallel the two. Yeah. And so I guess another question about residency applications is, how many programs do students generally apply to? And I'm very keen on expenses because that's a major feature of what I do when I talk about students applying to medical school. How expensive is the residency process?
Yeah, so it's a great question. Two things. One, how many is very, very, very dependent on specialty. I would say for the most, middle of the road specialties in terms of competitiveness, such as like internal medicine, emergency medicine, anesthesia, we want to apply to like 30 programs or maybe less, maybe 20 to 30. However, I have some friends applying to dermatology and orthopedics, and they apply to much more. So it really depends there on what specialty you're applying to. In terms of cost, I heard that this can be paralleled to the cost of applying to medical school in terms of the application itself. However, interviews may be virtual still. They may keep that with or without COVID. It's kind of like something that hasn't really been declared yet. So I think that could reduce the cost, significantly in terms of travel expenses.
Yeah, especially if you're applying to so many programs. And for most applications, depending on how competitive it is, I find that there tends to be way more interviews for residency positions than a traditional medical school applicant, just because there are substantially fewer residency applications being submitted versus 53,000 applications for medical school. So that's an interesting point. So can you walk us through then, I guess, when do you have to submit your information? When do you rank? I know you will use ARAS, but can you tell us a little bit about that real quick? Nothing too in depth. And then, what follows after you submit?
Of course. So I will submit the ERAS application with the letters of recommendation and my step 2 score and all the stuff in the end of September 2022. And then I will wait and I will get interviews, hopefully, in November, December, and January. So I actually scheduled time off during those 3 months, similar to what I did before medical school. And then after interviews, you kind of wait, and then you can start ranking your programs. You submit your rank list to ERAS no later than the end of February 2023. And then match day is in mid-March 2023. And then you know where you're going.
Wow, it's a scary process once you kind of lay it all out there like that.
Yeah, I know. It is scary.
So you mentioned everything, the process of the application, and you mentioned you took some time off for interviews. So what is fourth year like then after? Because I know some students might actually have rotations like on match day or after that. What does that really look like? Is it usually pretty lax, or does it turn into a giant vacation, or are you still expected to kind of hang around and check all your boxes?
So for my school specifically, you have to have at least 6 credits in the fall and in the spring, which translates into at least 4 weeks in the fall and in the spring, which is not a lot. Fourth year is very lax in terms of time off. Like, I think I have off like 3 months in the fall and 3 months in the spring. I don't even know how much time that leaves me, but yeah, there's a lot of time off. I'm planning to get a puppy during.
It's a lot of work. We just got one as well. So
really, oh, nice, congratulations.
Well, thank you. And so leading into that too, obviously you haven't had fourth year, but you're expecting it to be a little bit easier besides the interview process. Out of all the years, which year do you think was the most challenging for you?
First year for sure. I think the transition into it and just the sheer amount of information that you're learning in the beginning is the hardest, and it was the most challenging for me. Once I kind of got a good handle on it and we transitioned more into clinical curriculum, and I had a better support system, things got easier. And I would say third year, best year so far.
That's reassuring then, because I'm looking forward to it. I just have to survive the STEP exam. So I guess last question, are there other specialties that are highly dependent on pharmacy knowledge? Some come to mind would include like anesthesia or oncology, but are there others that are less obvious?
Yeah. First, like probably most of them except for surgery, but some like surprising ones for me, definitely like family medicine, internal medicine, like general, very like a lot of it is medication management. The large majority of the day is spent on medication management for these physicians. Other things that I can think of, obstetrics and gynecology, pediatrics, just anything in internal medicine, really. Anesthesia for sure. Yeah, I think that's probably.
Yeah, that's a good list, especially like with family medicine. There's so much polypharmacy that you're working on and managing and optimizing medications, which is just a unique skill set that a lot of the medical education system, at least in the first 2 years, doesn't really focus on. So I think that's I think it is reassuring to know that like pharmacy is much more extensively utilized, in the clinical realm versus, what we've seen in our textbooks.
Oh, yeah, much more.
All right. So we are coming to the final few minutes of our show today, and I want to ask a few closing questions. So how do you think your pharmacy degree will help with your ability to practice medicine or communicate with patients in the future? I know you've somewhat answered this a little bit, but we're thinking long-term per se.
Long-term, I think it will give me a leg up in quickly identifying, issues with medications and formulating good medication therapy management plans. And I guess on a deeper level, it allows me to really understand what I'm prescribing and doing for my patients as a cardiologist. Medication is one of our biggest tools. So I think having that background and that understanding can give both me the confidence and maybe the patient even a little reassurance that, I know what's going on and how.
Awesome.
Yeah.
Yeah. And I guess for individuals considering medical school after pharmacy school, do you have any recommendations you'd like to share with them based on your experiences thus far? Any tips?
Yeah, I would say if you really want to do it, try to tune out people that are telling you not to do it, because it was the best decision of my life. And I think that if you have an organized plan and you're willing to put in a little extra work on the front end, the dividends are plentiful in the end. So I'd say go for it, and keep your head up and keep working.
Yeah, and I think that's such a positive message too, to kind of reiterate that is, for individuals who are considering this particular pathway, you might come across some resistance, which, not especially like, for instance, one of my examples is from my parents. They're thinking, oh my gosh, you're going to add 4 more years of your education, you're foregoing a 6-figure salary, and you're doubling your loan burden. What are you doing? Like, just don't do it. And obviously they're very supportive, and that's not something they would, took to heart. But it's just another feature. Like, you might come across that in your clinical setting, on your appy rotations, when you tell, a preceptor or something that you're going into that or considering medicine. So I love that comment.
Yeah.
Alrighty. So 1 or 2 more questions. So I want to say, I think there's a general frustration in the pharmacy profession that physicians can sometimes be unaccepting of recommendations or pharmacy input. What are some ways that we can help break down some of these walls, per se, between the professions and open up better lines of communication?
Yeah, I think that's very true. And I've seen really good examples of how we can break down these layers, or these walls, actually in practice. I think it's really a good idea to have the pharmacist not only on rounds, in the hospital, but have them be present like before rounds also, and have them go and see the patients and really just increase the communication that they have with the team. I was on a team in internal medicine, and we had a pharmacist, and she would just be there during the whole process. And anytime any question about medication needed to be answered, she was there. She was ready to answer the question and be a really valuable resource. So I would say just open lines of communication and trust between team members.
Wonderful. All righty. So we have come to the end of our interview, and I'd like to thank all of our listeners for their attention and interest in medicine. If you have additional questions about the medical school journey, check out my personal website at www.physicianpharmacist.com. Before we let you go, Tess, how can our listeners get in touch with you?
Yeah, of course. They can email me, first and last name at gmail.com. Also on Twitter, first and last name. So feel free to reach out.
Wonderful. And that information will also be included in the show notes. So feel free to check that out at the end. So thank you so much for being on the podcast, Tess. I look forward to seeing where medicine and pharmacy take you. Best of luck with your rotations and residency applications, and step 2 as well.
Best of luck to you too. Thank you so much for having me. It was a pleasure.
All righty. Have a wonderful week and take care.
All right. Take
Bye-bye.
care. Bye.